Michael and Carolyn, this came to the forefront today on the local, state, and even the federal level. That concern you speak of, that COVID and the response to it are disproportionately affecting some demographic groups, including an elevated mortality rate among African Americans. As the pace of testing increases and hospitals are seeing ever more COVID patients, California's Governor Newsom addressed an issue getting growing attention.
Because the disparities on testing are a point of obvious and real concern.
In states that gather data correlating COVID deaths with race, data show a disproportionate number among African Americans. Today, LA County health officials released preliminary data for 97 COVID deaths, 17% among African Americans, who comprise about 9% of the county.
By the total population of each group, African Americans have a slightly higher rate of death than other races.
Today, the U.S. Surgeon General said African Americans are at a high risk for COVID disease. And California's Surgeon General offered this analysis.
Because of the true and unfortunate history of medical maltreatment of different groups of people, but especially African Americans in the United States, there are real issues of trust between the African American community and the healthcare system.
When it comes to testing, the data show more tests and more positives and a higher per capita rate in more affluent neighborhoods, regardless of race and ethnicity. We've highlighted the areas with per capita rates over 200 per 100,000 people.
People who are living in wealthier communities have had, in fact, better access to testing and, in fact, have been tested more than people who are living in communities where income levels are much lower.
And this might actually reflect the disparities that have pre-existed within our healthcare system in this country.
And so it's not that the coronavirus is necessarily striking people because of their color. It's striking people because of their economic access.
Officials say there has been a concerted effort to make testing more accessible across LA County. Resolving the issue of access to care may be more difficult. The latest LA County numbers show an additional 22 deaths the past 24 hours, bringing the total to 169. An additional 550 positive cases, raising that total to nearly 7,000. Across LA County, a total of 1,510 have been hospitalized at some point. 869 still are. And let me fix a slip of the tongue. LA County now has demographic data on 93 COVID deaths, not 97. And Dr. Burke Harris made a point of dispelling a dangerous urban myth. African Americans have no greater immunity against COVID than anyone else. Reporting live, Patrick Healy, NBC4 News.
Yeah, important to